Now, the Rohingya are struggling to access essential medical care. In Rakhine State, where most of them live, tight restrictions are in place, limiting their medical options. CCTV's Dave Grunbaum has the story.
Shahinas Bibi is in agony. For several days, she has been struggling to urinate and defecate. Her sister tries to comfort her, but the pain will not stop. Bibi is at a 14-bed medical clinic for Rohingya Muslims on the outskirts of Sitwe in Myanmar's western Rakhine State. It's a weekend, and there are no doctors around. Just a few nurses in the morning and a medical assistant in the afternoon. Patients complain that there's not enough doctors or nurses to take care of them, and that there's a shortage of medicine too.
We have trouble getting the right medicine for the pain.
More than 100,000 Rohingya live in camps or displaced after their homes were destroyed in riots 4 years ago. Many of them turn to this clinic for medical care.
If a Rohingya needs to go to a hospital, there is one in downtown Sitwe about 20 minutes away. But Rohingya need to get special permission. The doctors and nurses here at this clinic can arrange that, but that takes time.
And time matters in emergency situations. A recent report by Harvard University Medical School says the Rohingya face discrimination when it comes to accessing health care. 7-month-old Mohammed Ayas has a serious case of diarrhea, which can be deadly, particularly for malnourished children. His mother says Mohammed might have had contaminated food or water.
My
boy has diarrhea and vomiting and has so much stomach pain. His body was trembling and dirty water came out of his mouth and nose.
There are no child-sized needles available, so the medical assistant uses one for adults. He's attaching an IV in order to hydrate Mohammed, but he also plans to recommend that this baby go to the hospital. According to the Harvard report, 40% of Rohingya children under the age of 5 who live in these camps suffer from diarrhea, about 5 times the rate as other children in Rakhine State. The medical treatment around here may not seem like much, but for the Rohingya, their options are limited. Dave Grunbaum, CCTV, Sitwe, Myanmar.